The World Health Organization has designated 2020 as the International Year of the Nurse and the Midwife. These two professions are among some of the oldest in existence and two of the most important. It is nothing short of heroic to see nurses and midwives working compassionately each and every day. They enable the best possible outcomes and the best experiences for our patients, from newborns to those at the end of life. As a former nurse myself and someone who spent 11 years at the bedside and then 7 years managing a team of frontline nurses, serving in my current role at Southlake, I am constantly reminded of why I got into nursing in the first place, and that's to help make a difference in the lives of others. We have amazing nurses at Southlake, over 1,700 in fact. RNs, RPNs, and nurse practitioners. We also have 10 outstanding midwives at our organization. People trust our nurses, and we take that responsibility very seriously. That is why we are always looking to improve, and also why we have partnered with the Registered Nurses of Ontario by being a best practice standards organization. Much of the modern practice of nursing traces its roots to Florence Nightingale, who came to prominence during a time of war and helped to proliferate what are accepted as standard practices today. This included everything from sanitation and hygiene to using data for improvement and continuous education. She also championed the compassionate element of the profession and helped define what it means to truly be by the patient's side. In honor of the 200th anniversary of Ms. Nightingale's birth, and in celebration of the Year of the Nurse and the Midwife, we asked some of our remarkable nurses and midwives at Southlake to share some thoughts on their profession and what it means to them.
We have patients that we see once, and we have patients that we see once a week. And either way, always providing that same support and continuity in their life is important. And that's part of the reason why I became a nurse.
Yeah, I believe the people that nursing impacts the most is our patients. They come into the hospital in some of the most vulnerable and uncertain conditions and states, and we as nurses are some of the first faces that they meet. They're unsure of the future, they're unsure about what's going to happen, and we as nurses have the ability to let them know that it's going to be okay, that we're there for them and they're in good hands.
Despite our job ending at the end of a shift, I don't leave my job behind. I still take part of it with me, rethinking what did I do over the course of the day? How can I improve on my next shift? What can I do differently that makes a difference for my patient and improves their overall experience and the care that they've received?
We're helping this family in their most vulnerable time, in real time of need. When you're scared, you're frightened, is my baby okay? Can I cope? Can I manage? And we're there to do that.
But sometimes we're that person that you confide to, or sometimes we're the hand you hold, and sometimes we're the shoulder you cry on. And those are all moments that are important for, you as patients, and that's what matters to us as nurses.
To all of the nurses and midwives here at Southlake and around the world, thank you for the work you do, the lives you improve, and for the unending compassion that you bring to our families, friends, and loved ones. At Southlake, you're all core to our overarching goal, leading edge care by your side.